Hello, everyone. Welcome back to Hot Seat. I'm Omid Moghaddas joining you from Tehran, and I'm so super excited that I have a very dear guest. Professor Cleopatra Nacopoulos is here with us from Athens, Greece. Hello, Cleopatra. Welcome to Hot Seat, and thank you so much for accepting this invitation.
Thank you so much for having me to lecture about Cleopatra technique, PRF aesthetics, and present my work. I think you're doing a great job to gather all these colleagues from all over the world to present their works, and I highly believe that all together we can make the difference. Congratulations.
Thank you so much, my friend. And for those of you, I'm pretty sure you know Professor Nacopoulos because of her work and what she has done in the field of aesthetics, specifically on the facial aesthetics. And I'm not going to go to the details now because I'm pretty sure after her presentation you will get lots of things in your mind, and at the end we will have a discussion on the topic. And as she presented, the topic that she will talk about for all of us is PRF, facial aesthetics, and Cleopatra technique, because she's one of the leaders in this field and she has so many innovations that I'm so thrilled that she will share with us during this evening. So before we start, I will have her CV for all of you. I'm pretty sure she doesn't need any introduction, but it's a tradition, so I will have her CV for all of you. She was born in Athens, Greece in 1985, received a Bachelor of Science degree in biology at Gannon University in the United States. 1991, degree in dentistry from University of Athens School of Dentistry. 1998, master degree in oral biology, and then clinical specializations in periodontology. 2007, certificate of master degree from Sola Academy at the University of Vienna. 2007, clinical training in perioral aesthetics with the use of fillers and growth factors in Beverly Hills, California. 2008, associate fellowship at the World Clinical Laser Institute. 2013, diplomate certificate degree of ICOI, and then in 2015, doctor at the Medical School of the University of Athens. Also, the Master of Science in Medical Aesthetics from Queen Mary University in London. She's an Associate of Research Laboratory of Musculoskeletal Diseases of the CAD Hospital, frequent speaker at so many events, and has published many great works in the field of aesthetics and implants. She is the former Vice President of the Greek Laser Applications, President of WAUPS Greece and Aesthetica, visiting professor at the University of Nicosia, State University of Medicine and Pharmacy of the Republic of Moldova, and has a private clinic in Athens and in Tripoli, and she exclusively deal with periodontics, microsurgery, laser, implants, and facial aesthetics. Thank you again, Cleopatra, for joining us. I think your valuable work and your valuable CV says it all, and we are super excited for your lecture and looking forward for the discussion at the end. The platform is all yours.
Okay, thank you so much. Let's start. 1 second. Okay, today we're going to talk about PRF, facial aesthetics, and Cleopatra technique. This is me. This is my motto, stay young with your own blood. And I really and highly believe that nowadays that we have lots of problems with viruses, with artificial products. If we have the opportunity to use our blood in order to improve our skin or to heal our own skin, I think this is a revolution. The story started a long time, as you said, because my first degree is biology. So all my time, in my mind, in my soul, I have biology, and whatever I do, I want to make sure that it's biologically safe, and it's the best way to treat my patients. After that, I became a dentist. I am like you. I work every day. I face all the problems and the difficulties that you do in your countries. And as the time passed, I wanted to get more knowledge in order to be able to serve my people, because my motive is to make best for the people, not for myself. So I did periodontology, I worked with lasers, I used to be the president of the Scientific Society of Laser Applications. And then a long time ago, I started with growth factors. Of course, the first protocol that I used was PRP. I have done thousands of cases because, as you know, I'm a periodontologist and I do oral surgery because my PhD is about bone augmentation. And when I did my PhD, I used PRF alone. I use PRF with combination with grafts, and I use it only with grafts. And I saw the advantages and how powerful was the PRF. And at the same time, because as I told you, I have started since 2004 with the growth factors, I had the idea of using PRF for facial aesthetics. I was the first one to do it in the world, and I was the first one to present it in United States when Rick Myron invited me to do a course there. I introduced PRF to him, and of course, I did. I gave them all my work when they wrote the book about the regenerative medicine with Joseph Sucru. So I think, and I strongly believe that we can do it with this alternative way by using our own blood to enhance every procedure that we do in dentistry and in aesthetics, and not only, because I am going to present a case to see what I did in another area of the body. So this is me, doesn't matter, I am a fighter, I'm nothing else. Anyways, nowadays, a lot of people are seeking aesthetic procedures. They come to our clinics and usually they only want dental care. But if we can show them that we know about aesthetics, and of course, if we present our work, they can trust us to do something in order to improve their face. And of course, I'm not talking about surgical approach, but I'm talking about non-surgical approach, because surgical is something that will be done by a plastic surgeon. And of course, I am not a plastic surgeon, I'm not a dermatologist. I am a person who I know facial aesthetics, and I can do my part. If the case is hard, if the case has pathology, I strongly believe and I advise you to refer it to a specialist. Now, about the non-surgical approach. We have lots of advantages, because with a very minimum way, we can do a lot of things in order to improve the facial appearance. And from the other hand side, we can do treatments which are fast, easy, safe, because they don't have to go to hospitals and all this. And of course, if you do something which is non-surgical, it has less pain, less wrinkles, and the most important thing is that we can maintain the authenticity of the face. Because if you do, let's say, a surgical approach, what is going to happen? You are going to change your appearance forever. If you want to change again, you have to have another surgery. So with the non-invasive treatments, we can do minor things, but if we start at the early age, we can achieve very, very good results. And of course, we can go either with things that they are injectable, we can inject them inside the skin, or with things that they're not injectables, and we can apply on the skin, and we can improve the facial appearance. Now, We have the first way, which is non-autologous, and the things that we know the most are the botulinum toxin or Botox and the fillers. And the most famous one is the hyaluronic acid as a filling material, because there is an antidote in order to be able to repair any problem. For me, the best way is the autologous way, and we can do it with the fat. The fat is the best filling material, and the fat has the adipose stem cells that we can fill up the space, and at the same time, we can stimulate the collagen reproduction. But if we don't have the ability to use the fat, we can use the blood derivatives, and with the blood derivatives, we can stimulate the fibroblasts to produce collagen. If we can combine the both, like fat and blood derivatives, this is, of course, ideal. These are cases that either have been done with the blood or with the fat. You imagine that the combination will give more benefits and will remain the results longer time in as a procedure, as a facial treatment. Nowadays, again, as I said from the first part of my lecture, a lot of people are going towards the regenerative medicine, because with this, we can use something which is totally autologous, such as the blood, and this is very safe for the patient because it's not toxic, doesn't create any allergic reactions, doesn't harm other tissues, and very, very trendy are the stem cells therapies. So if we can combine everything, because in medicine, everything is a puzzle. If you put one piece, it's not enough. You have to put many pieces together. This is my philosophy, and that's why I studied periodontology, laser, bone augmentation, facial aesthetics, because I really believe that we can put all the little pieces together in order to have amazing results. So we are based on the components of blood. And what do we do? This is very, very easy. It's as simple as thinking and procedure. We use the blood. This is the platelet concept. And we centrifuge this blood in order to do what? To increase the components that are helping us for the healings, like the platelets, the leukocytes. We can get some stem cells. We want to multiply these factors in order what? To accelerate the healing process. So the first protocol was, of course, PRP. And why? Because with PRP, we could have it in a liquid form. This was very important, because how can you inject inside the skin something which is a gel? So as blood concentrates, we have mainly three protocols. We have the PRP, platelet-rich plasma by Marks, 1998. Then we have the Anituas protocol, which is the plasma rich in growth factors. And then we have the platelet-rich fibrin by Joseph Choucroul. PRP now, I don't say, because some people, they have misunderstood. I don't say that PRP is not good. Of course it's good and it's working. The thing is, if we have something which is better, and always in life, we try for the best. Now, about PRP, because I did my dissertation paper when I did my master's in Queen Mary London School about facial aesthetic medicine. There is no consensus, and this is a problem when you see all the articles. There is no certain count of cells. We cannot talk about a certain speed, and the time of the centrifugation inside the machine. So we cannot standardize the results. And this doesn't have to do with the PRP itself, but it has to do with the people that they didn't follow a protocol. Everybody is buying a machine. They try to change the inclination, and they try, from maybe greediness, to make their own protocols, and they don't respect one who has invented. I don't care who is, PRP, PRF, PRGF, doesn't matter. But if you want to follow a protocol, you have to follow the protocol from the machine, from the inclination of the tubes, from the time, from the count of the cells, from everything. And this is important. So with the PRP, of course, it was the first generation, and everybody has worked with PRP with very good results. But we had lots of problems. We had anticoagulants. In the beginning, we had the thrombin. After, we had to mix it up with other chemical things, which we don't like because we go towards the regenerative medicine. And of course, high G-force. Can you imagine? It's like you put something inside a tube and you go very, very, very hard spinning. Then what you do, you destroy the cells, or you make a big damage to the cells. So we wanted to find something to simplify the procedure and to be more gentle to the cells. Now, from the other hand side is PRF. PRF convinced me as a biologist that is a superior product due to the fact that, first of all, we have the fibrin, and everybody knows what is fibrin, and of course I will explain to you. It's the third generation. That means we have the evolution of the blood derivatives by the time, and of course gives us the regenerative cells that will help us to enhance the healing procedure. So the Cleopatra technique, the PRF aesthetics, is based on the low-speed centrifugation concept. And by this concept, we try to reduce the G-force in order to save more cells, in order to get something which is injectable. That's why we have I for injectable, PRF. And of course, this is full of white cells. We need the white cells in order to do what? To enhance the healing process. So this is very important to understand that we started very high and gradually we're going to low speed, low G-force, more love and affair to the cells. We don't need a lot of cells. We need powerful cells. And these powerful cells are coming from PRF. And I am a person who I have used all the protocols, thousands of cases, and I consider myself, I'm not selfish, but this is the truth, that I have a lot of clinical, not only from research that I do in the university, because I am a scientific collaborator in Athens Medical School, but I have done thousands of cases because you see the problems, you see how to manipulate, how to do all the protocols. So let's go back to the low-speed centrifugation concept in order to understand what it is. In the beginning, the PRF was, we were spinning it in a high G-force, 708, so we had few growth factors and leukocytes. And as we go down and we reduce the G-force, we can achieve, and I'm talking about facial aesthetics, a PRF liquid that has more growth factors and leukocytes. And of course, the most powerful product is the IPRF, because the IPRF has lower G-force. It is more gentle to the cells, so we can get more growth factors and leukocytes. Now, how now we achieve the IPRF plus? We have now the new tubes, the tubes that they are 13 ml as a size, and they have this purple cap. They're totally sterilized, and we centrifuge these in 700 rounds per minute for 5 minutes. And of course, we have this study that shows that if we have nothing, if we have, or if we have IPRF, we see with IPRF, we can get more cell migration. This is what we want. more proliferation of the cells, and more collagen synthesis. Here you see that we have more collagen type 1, PRP, IPRF. You see the difference here. And of course, we want something which is very powerful, but we need more collagen. It is different if we're talking about rejuvenation, that means on the surface of the skin, but if we want to fill up wrinkles, we need something which is more stable. So we need more collagen. We have to find a way to increase the fibrinogen, and for that, we have created the APRF liquid. APRF liquid is a biological filler that in some cases, and most of the cases, according to my clinical experience and my knowledge all these years, it has to be combined with IPRF, because IPRF plus has a lot of cells and APRF liquid has a lot of fibrin. So we combine the fibrin and the cells in order to have the best biofiller. And this biological filler can be centrifuged in 1,300 rounds per minute, either for 5 minutes or for 8 minutes, according to what you want to do, because the most important is in this protocol is how you centrifuge the blood, the G-force, how many rounds per minute. If you increase a little bit the time, doesn't matter, because you get the same quality product. So now, by using this protocol, we can talk about tissue engineering, we can talk about regeneration, and of course, how can you have regeneration? By new blood vessel formation, which is helping us, the inflammatory cells, the growth factors, the bioscaffold, which is a fibrin, and of course, the stem cells. So all the puzzle is here, and all the puzzle is here for us. So what is the idea? The idea is this: Cleopatra technique, as all the treatments that have to do with the injectables, they're based on the trauma. So we traumatize the skin by any kind, needles, derma rollers, dermapen, doesn't matter. This trauma goes over these 4 phases, and at the same time, we put PRF liquid, either in an eye form, IPRF, or APRF, or the combination, which is the Cleopatra technique, because I explained you the reason why I decided to combine IPRF plus and APRF plus, and we can inject it inside the skin. So here we have IPRF plus, here we have 60 G-force, the color is more reddish, and here we have 208 G-force, and the color of APRF liquid is more yellowish. This is one study that I did using the telomeres as a biomarker in order to see how was the satisfaction of the patients which they had the treatment. And this is a very good way, by using these telomere lengths, in order to be able to design new studies, because this is something very new. As I told you, it was an idea. I started a long time ago. I did the first publication, then this was, I think, the second about all this idea, and now a lot of people all over the world are following, are using PRF, and I'm very happy that I was the first to have this idea and give my patients the best regenerative treatment. And this is one of the latest publications that we did with Dr. Ana Maria Vesalas. She's an oral surgeon. And we evaluated the treatment in the lower face. And of course, the patients were very happy, as the treatment is easy, is safe, and is cheap. With this protocol, because my concern is not only about myself, but for my colleagues. By using a machine, by having these tubes, you can reduce the cost. And this is very important, but you keep the safety of your patients to the top, because this is something that you cannot negotiate about. Safety, for me, it's the best for my patients. As a procedure now, it's very simple. We have to prepare the skin. We do the anesthesia, either the topical, or we can do local, or we can do infiltration, like a nerve block. Doesn't matter. We can do many things. Depends on the sensitivity of the patient and how aggressively we want to go in. As materials, I told you, we don't need to have too many things. We can have our syringes, little needles, and of course the tubes. It's as a procedure easy. This is important and safe. We can draw blood. This is important. It's a procedure that you should learn, and always don't forget to disinfect the area from which you get the blood, because this is very important. You don't want to get an infection to the patient. Now, how can we rejuvenate the skin? I said we can cut the skin, we can puncture the skin, we can abrade the skin, we can hit the skin and create a blister, or we can hit our knee, for example, and get a bruising. If we get these kinds of trauma, ourselves is going to go through healing procedure. So for the face, in order to do that, we can use either a derma pen, we can use our syringe or a derma roller. We have to find a way to traumatize the skin and then to apply the PRF. The procedure is microneedling. We have this derma pen. We can use the derma pen, and we can treat the face, and we apply the PRF on the top of the skin, and then we use the derma pen. If you do this treatment, you should be careful to know how to do microneedling, and of course I teach everything during my courses. And as a protocol, everybody is asking me, in order to be able to talk about a protocol, because this is a regenerative medicine, you have to be able to evaluate the skin. This procedure is something that it's not so easy, because you have to know what is the disease in order to treat it. You have to evaluate if the patient has periodontitis or aggressive periodontitis. You don't treat it the same way. The same is with facial aesthetics. So they have to have a training, a good training from people who know what they're doing and how to teach them. And just to give you a rough idea, if we do this treatment, we can do it one treatment every 15 days, or if we do a very aggressive treatment, we can wait like 3 weeks or a month and then to repeat the treatment. As an advert, we can do 3 to 4 sessions. Another treatment that we can do is the point-by-point or micropapullar technique. And with this, what we do, we have a syringe, which has a small needle. And what we do, we inject it inside the skin. And according to the length and the size of the needle, we know where and how deep we go. And as you see here, this is a case that I did the neck. I did the micro papular technique. That's why you see these small papules here. And I did the micro needling with the derma pen. So in this case, I did something in combination. And of course, this is right after the treatment. With PRF, we have so much good and fast healing that you cannot compare it with any other product that you apply on the skin and you do the microneedling. Now, if you want to do augmentation, and this is the challenging is how to reverse the time in people that they are, for example, over 40 years old, 50, 60, 70 years old. This is challenging because you have to fill up all the wrinkles. So in this case, there are many things that they have been done. For example, we have to restore the lost volume, to do the contouring, maybe an asymmetry from slipping from one side or the other, to treat the acne scars. So we have to have a lot of guns with us in order to win the fight. So in this case, we combine the two. This is Cleopatra technique. And of course, we can have different needles in order to stimulate the fibroblasts to produce the lost collagen. And we can do it, of course, with cannulas. Cannulas are blunt needles that they cannot destroy the vessels and the arteries and all this, but we have to go slow. And of course, the safest cannula is the 22G. After the treatment, they can either put a mask, they can put ice, or we can use some phototherapies. With the phototherapies, we give energy to the cells and we try to promote the microcirculation and of course the healing process. We can use a face mask that has peptides, hyaluronic acid, vitamins, doesn't matter, that is put on the face right after the treatment and reduces the edema and the redness. And of course, one of the most important things is to give instructions to the patient according to the skin. This is not a busula, because they call me thousands of people all over the world and they ask me questions. It's not I answer one question. You have to understand the philosophy, because you cannot treat the same, all the faces the same way. Important is the aftercare treatment. And of course, as a guidelines, I tell you that they can use ice if they don't have any phototherapy or any masks. Of course, they have to avoid the sun exposure, to protect themselves from sun, like to put a sun protection cream, at least with 30 SPF. And there are some homeopathic products as arnica that they can put on the face to reduce the pain, if there is a pain, and the small edema or bruising. Now you see some cases before and after. My cases don't have the perfection of something which is artificial. It's something that is built up step by step, because actually what I'm doing, I am stimulate your own self. For example, you are much younger than me and you're from another country than me and you live in another environment than me. So we can have like a recipe and say, okay, this will happen. It has to do with your own system, how you eat, if you smoke, if you exercise, if you drink water. So it's something that it's been taught through my courses in order to be able to evaluate the case and to talk about the prediction of the case. These are some of the cases that I used only Cleopatra technique to improve the size, shape of the lips. And you see some of my cases, the lips are not losing their real anatomy. They have the ridges, they have the bumps, they have the wrinkles, they have the contouring. It's not like you see big lips. For example, to give you an example, if you have a person who is a white person, the upper lip is smaller than the lower lip. But if the black person, the lips are symmetrical. So you cannot change the characteristic and the identity and the authenticity of one person. So these are the things that you should know and are taught through my courses. These are some other cases. And of course, if you can work in combination, if you fix the teeth and if you fix the aesthetics, this is ideal. And of course, in some cases, it's a combination, like in these implants by Dr. Delaka. Hadji Georgiou is a lab patient who worked on the case. I did the facial aesthetics. So all together, we try for our best. This is another case that I did 4 treatments only with Cleopatra technique, and you see the difference here. A lot of people, they told me, oh, she has done Botox. She did nothing. I re-stimulate the collagen production because I re-stimulated the fibroblasts, and step by step, in a period of a year, I could get this kind of result. And a lot of people all over the world are asking me about my new technique, which is Cleopatra Technique Plus, the combination with hyaluronic acid. Of course, I use hyaluronic acid. I'm working on that, but I will give you a hint. The hyaluronic acid, I have mixed INA PRF, and all together, it's been mixed with this 3-way valve in order to have everything at once, like IPRF, APRF, and hyaluronic acid. In some cases, I use very liquid one. In other cases, I might use like a soft type or middle type, depends what is the case again. And these are the results I can get. In this case, I didn't only get good results around the mouth, but I eliminated the acne, because some women have the menopause acne after the years of 45 years old. They get some acne here. This is not the active acne that adolescents have, and you can get the infections. Some pimples here or there. So by this treatment and by stimulating the area, you can get this kind of results. This is a case that I worked for many years. We started step by step. This patient trusted me because with my technique, the results are not immediate because I have to stimulate the fibroblasts and I have to wait until they build up the collagen. So I stimulate, wait, and this is the way how it goes. And you see this phase, how it's changing through the years. And of course, this is something that it's getting better. The patient has fixed the eyebrows because, you know, we did some dental work. She changed her hair. She changed the color back. And this is the patient from where I started. So this took me 3.5 years with a lot of love, with a lot of trust, step by step. And this is what you can achieve. My treatment needs patience. You cannot do it in one day. Of course, how can we do it? We can do many things. We can have chemical trauma, like chemical pills, apply PRF. We can use laser with PRF. We can use any kind of treatment with PRF. PRF is a gold standard. It is for the resculpturing of the body, because this is something which we have and we can combine it with everything. The question is how we do it, when we do it, and when we don't do it. And of course, we have to go through this learning procedure. So Cleopatra technique, of course, goes with chemical pills, because you do what? You cause a trauma, you distract the defense mechanism, the skin, which is our organ. It's a big organ, it's a smart organ, doesn't allow anything to go in. So we destroy some layers of the epidermis. Sometimes we go even deeper and we apply the PRF. We can use it with lasers in combination, because we create trauma, and then after the trauma, the PRF to promote the healing process. In this case, again, I'm using my lasers, I BioLase. I am one of the first people in Greece that I use BioLase laser for perio treatments. And of course, I combine periodontology with PRF for regenerative periodontology. And I will have pretty soon a webinar about that. So what I did the treatment and I used the laser for the small pimples she had. Then I injected for the décolleté and the neck. And I finished the treatment with the microneedling. So PRF goes everywhere and PRF is totally safe. This is the message that you all have to take home. Don't be afraid of your own blood. Just be afraid if you don't know how to use it properly. If you want to get knowledge from the people they have invented it and they know how to use it. In this case, what I'm doing, I am using an Nd:YAG laser and I am cutting the moles. This is from the face or from the neck. And of course, in this area, you can apply some PRF in order to promote the healing. This is the low-level lead treatment. Sometimes I do low-level laser treatment. Again, depends on the case. And with the low-level lead treatment, I use different wavelengths from microcirculation, from reducing the edema, from calming down the skin, depends again on the case and what I want to do. Lately, I'm using another machine. This is a Biotron machine and repairs the body using their own cellular process, has no side effects, of course, and we can again combine it with a lot of treatments like I do a big facial treatment with PRF, very aggressive, and then I can use this device in order to promote the healing. And you see how the skin is becoming after almost 1 month. How can we use Cleopatra technique with threads? Yes, I am using in combination. This is how we put the PDO threads. I don't like the cogs because I don't feel safe with cogs and I prefer to have either the monofilament or the twisted, and I combine it with Cleopatra technique. Another way, when we took with my friend, he asked me to talk a little bit about Botox. Botox is a big thing. I am going to have pretty soon a webinar course about botulinum toxin. But what I want to tell you, Botox is different fillers. Botox, we can relax the muscles, and with the fillers, we fill up the muscles. In the face, we have two parts. We have the dynamic part, that means Botox, and we have the static part, that means PRF, or that means fillers. My philosophy says, and my clinical experience, that whatever you do, you should start with the treatments with PRF. So in this case, I did PRF treatments, and then when I finished the 4 sessions that I did Botox. And this is what it happened on the forehead. This lady lives in Greece. She went to a dermatologist. He did a chemical peel because she had some pigmentation. And what happened? She got all this pigmentation on the forehead. So when I did the treatment again, after the Botox, after 4 months of the Botox, I did the treatment again. And I was waiting. And what I saw this forehead. It was amazing. I could eliminate, she still has some pigmentation, but from this pigmentation, I could go to this forehead. So for me, it was You have to have in mind that when this patient goes back to the sun without sun protection, then the problem will come back, not to the same extent. And of course, these are two cases from Dr. Bni in Nice. He is working with Joseph Choucroun, and what they're doing what I said in the beginning. They're combining the fat, which is the best and most natural filling material, with adipose stem cells, with PRF, and they have great results that they last in time. One very important factor that we don't just forget is that with PRF, we can treat complications from fillers. And of course, this is the case that we did with Professor Ganati from the University of Frankfurt, and it was about a lady. She had done at the temporal area hyaluronic acid. She got to a big infection. They had surgically excise all the infection, and she ended up with this kind of problems at the area of the temporal area. And after injecting her for 2 years with PRF, from this fistula, we have this kind of skin. So with PRF, we cannot only use it for aesthetics, but if you know how to use it, we can repair a lot of problems. And thank Professor Ganati for the cooperation in order to do this publication. Now, something that was given to me from Joseph Choucroun. These are some people who have diabetic ulcers, and by putting RF, we can promote the healing. Why? Because we get more vascularization by the new vessel formation. And this is one case that I did. And this lady, this is a breast, and this lady got a big burn when she took the tray out of the oven. And she had this kind of problem for 15 days because we put the bra here and we have the clothes, so this couldn't heal. So she came for the period treatment, and I proposed to her that maybe I can do something with PRF. I knew what I could do, but you know, my area is here. I didn't want to force her to do this kind of treatment. And I proposed to her and I said, okay, can we do something? She goes, what? I have something magic that I will make it. I will put it there and you see the result. So I made big membranes of PRF. I clean the breast with saline water. I put the membranes of PRF and I used some plastic and I filled it around in order to keep the hydration there for 2 days. And these are the photos that she sent me 2 days after. These are from her cell phone, so you see the difference in color, but you see how the area, how the wound was, what I could achieve in only 2 days. And of course, this is a week after, and you see how fast the healing of the tissue is becoming. We can use it for hair treatment, as in this case, and we can increase the vascularization of the hair bulb and increase the regrowth of the hair. Of course, we cannot talk about for people that they have alopecia and are totally bald for many years and put PRF and you have hair again, but we can use it in some cases to prepare the skin for hair transplant. So these are some of the cases that we can do. And of course, we can treat arthritis. This is a video given me from Joseph Choucroun. He has a pain clinic, you know him, doesn't need any introduction from me, but he is a great mind. he is a person who helps other people to grow, and he's pushing you sometimes to the top with force, but he's pushing you to the top. So this is how he's treating arthritis. So I had the idea of using PRF to treat arthritis on the hand. This lady, she had ankylosis to the finger due to the fact that she was using the knife a lot of hours a day. She has a restaurant, and I'm injecting PRF in the joints. After the injection, you feel like something itchy, something is going on. And after a while, with a little massage, you start having mobility in hands. This is a case that I did with 3 treatments, and this is how the hands are after. For me, if I can describe the procedure, every time that you do PRF for the arthritis, it's like you medication for 2 months. Because the patient starts having the feeling and the mobility of the hands. Of course, she told me that she couldn't sleep before from pain, and after the 3 treatments, she doesn't have any pain. This is from my country. These are people that they have trusted Cleopatra technique. They have trusted me, come from all over the world. And of course, I am very happy to have friends and colleagues in my clinic. In my clinic, do training on live patients. I show to my students step by step how to do the procedure. Of course, they use their own hands in order to learn the procedure. And of course, by closing my lecture, I have a lot of social media. You can find me in my pages, Cleopatra Technique for Aesthetics and Cleopatra Technique for Aesthetics too. And I have 2 groups, WAPS Aesthetica and Aesthetica by Cleopatra Nacopoulos. It will be my honor if you post your cases, dental cases, aesthetic cases, because I think with this way we can grow. Because if we put a little stone, all of us, one little stone, we will make the biggest castle in the world. But if we go against each other, we make nothing. So we promote each other and we learn from each other. Nobody is better than us. We can learn from the others, and we should be a close team. If you want to do my courses, you can get some informations in this page, GMDA Workshop Hub. And of course, I do different things, and I want to make clear, I am not an aesthetic doctor only. I'm a dentist, I'm a fighter, and I am a periodontologist. I put implants. I know how to use PRF in implants, in periodontology, in combination with lasers, and I can help people. Just send me an SMS, give me questions of how to do it, because this is the most important, to know the tips and tricks. And last but not least, I will be more than happy and honored to see you either in my country or to be able to come to your country, because right now we don't know what is going to happen the next hour. I wish to all of you to be safe, to be healthy, and God helps us all. Thank you so much for your attention.
Thank you so much, my friend Cleopatra. We truly enjoyed the presentation. And as you said, it's a very big topic to talk about. You really showed us every steps that we should think about as an option for treating our patients. For me, very interesting. Actually, I am one of your followers and follow your work. And I was really waiting for this session to come up with. And I personally recommend courses for everyone interested in aesthetic. And as you said, It's truly made. It's cheap, your own blood, and all you need to know is to have a good diagnosis, execution of the technique by learning it perfectly and not just watching a video, try to do something. No, definitely it needs a learning curve, and for with getting good courses, educators like you, reading books, articles, give up the knowledge and give our patients the best that we can. So um, I have some comments and questions regarding your beautiful presentation. If I'm right, your technique, as you said, is a combination of APRF liquid and IPRF plus to increase the fibroblast and at the same time to increase the quality of the cells available together for increasing the quality. Am I right?
What my technique is the combination of IPRF and APRF. And why? I said with IPRF, we have leukocytes, stem cells, and growth factors. But we need a stable concentrate in order for them to remain alive. The state, the bioscaffold is the liquid fibrin. Just imagine that we have a network. In the network, we have some insects that they're cut together. This is the idea. We need to have something stable, which is the fibrin, and then we need to have cells in order to have the wound, and at the wound, we give everything. So we have the overlap of the phase blood clotting, we have the inflammatory response, we have the proliferation of the cells and the tissue healing. And after 2 years, during the 2 years, we have the tissue maturation. Yeah. So my idea was that on IPRF, we get cells, but what is happening to the wrinkles? We need to have a liquid fibrin, a bioscaffold. And I want to tell something just to make it clear. If we have IPRF plus, still we have liquid fibrin in this, but we have less liquid fibrin, more cells. If we have the liquid fibrin APRF plus, F liquid, we have less cells and more fibrin. So in either protocol, I or A, both. But my idea was to increase one from one tube and to increase the other from one tube in to get the great number.
Yeah. And for having those two tubes, should we have two different centrifuges, or regarding the timing, it's okay to first prepare the first one and then put the other other tubes to prepare the second one? Or we need to have devices at the same time?
Number one, let's say that we have one machine. The important factor when you use PRF is to take the blood and put immediately. So if you want to make the protocol, you take, for example, 2 tubes to make F and 2 tubes to make APRF. So you take blood, 4 tubes, okay? So you take the 4 tubes, you put them in the machine. The first protocol, 700 rounds per minute for 5 minutes. When it's ready, the machine opens. You take 2 and you leave the other 2 inside the machine. You turn the button to APRF liquid, 1000 rounds for another 5 minutes, and then you make the APRF liquid. You put everything aside and mix them up, because with the new tubes, you have the PRF in a liquid form over 20 minutes. Mm-hmm. Okay, and now there are a lot of studies and a lot of things that we can increase the time that the PRF stays in a liquid form. because the challenging is how to keep PRF in a liquid form because it doesn't have any anticoagulant factors.
Yeah.
So with tubes and with this way, we can do, centrifuge all the blood together. In my clinic, because it's a big clinic, I have 2 machines.
Yeah.
So I can draw 4 tubes of blood and I put one in one machine and one in the other and I mix it up. If you have machines, okay, congratulations, this is ideal. But if you don't have, you can do it either way. With PRF, just to give you an idea, it's like cooking. Okay, you know how to cook, you know the recipe, but if you are a very good cook, a maestro, you can mix it up, add, you put your personal feeling in the case. This has to do with the education. I see the case, I see the need of the case, and I know how to proceed. And with PRF, at the same time, I can, let's say that I take it out and it's not so much. I can put it in the machine and increase a little bit the time, and then I can get more product instead of having to get more blood. But in order to know all this, you have to follow an education. And a lot of things are taught to me by Joseph Sucrun, because believe it or not, and we have to respect that, he is the father of PRF and he knows a lot of things. So many times that I have a question, I have a problem, because okay, I invented aesthetics, but PRF comes from him. So a lot of time we change a little bit the protocols, we increase the time, we decrease the time, because PRF is alive. PRF is not static. It's not, okay, we have a protocol 20 years ago and this is the same protocol. Everything is changing. Like when I started in 1991, we didn't have computers, only in the United States. And now we have like the cell phones and we have a computer in our hand.
Yeah.
So
Yeah.
for me, PRF is a revolution, an evolution.
Mm-hmm. And Cleopatra, you showed the advantages of filters in treating wrinkles and the facial aesthetics. And also you mentioned the botulinum toxin, the Botox. And one of the things that you mentioned was that you have to be patient with going with fillers because it takes time. And I really like the concept. But my question is now this: is it reversible going with the fillers? Is it the same as the Botox, or year by year it's getting better and better? I mean, I put it question this way: should we repeat the procedure, repeat the fillers every year? For example, in Botox, we say every 3 to 6 months we need to redo. So what about the fillers? How frequently we should repeat the treatment?
Okay, first of all, I'll tell you a trick. When you you fell down and you hit your knee and you have a big injury, how this is gonna heal? Have you remember as a kid, because you are a very young person, hit your knee and okay, it heals soon, but then the skin goes through a lot of changes, maybe over 2 years, yes or no? So what you do, it's the same with this kind of treatment. This treatment, you stimulate your own healing process, trauma, and then you put the PRF. This needs time until it reaches the perfection. But you have to have in mind that in the scale, from one hand side, you get older, from one hand side, your skin is getting better. So if you are 30 years old, maybe you have to make the equilibrium once a year. But if you are 65, you need 3, 4 times a year. These are the things, the tips and tricks that they can be taught from the people they know how to teach you. Because it's not, if you do the treatment, you're very handsome, you're young, you have a nice skin, if I do the same thing, that I am older, my skin is not nice, I have wrinkles, I cannot do the same thing. You are from another country, from another environment. I am from Greece. I have maybe more or less sun, doesn't matter. I feed myself with a lot of vegetables. I eat well, I eat a lot of fat. So what you're offering to your patients is a protocol, is a procedure, is a regenerative medicine. It's not just some punctures on the skin. The level is very high, but people, they take it unseriously. And this is the problem. You have to understand that you are the elite of the dentists that using blood derivatives. I don't want to say PRF. I don't want to be dogmatic. For me, it's PRF. But let's say you use the blood derivatives. You're doing something which is regenerative medicine. Regenerative medicine is not like a puncture and PRF. You put it there, you see the change of the tissue, you see how bone regenerates. You have to follow, I think you have experience with all this. You have to follow all the protocol. Surgery is not only the implant, it's how you open the flap, how you treat the bone, how you close, how is the tension, if it's a tension, how you put the stitches. It's the same with the face. The tissue doesn't change. The tissue is the skin, the tissue is the mucosa, the tissue is, I don't know, the gums. We have to think biologically. This is the problem. We are not like artists. We don't do only the work. We should have the science behind the work. And if you just, think outside the box, you will understand what you are offering to your patients.
Exactly.
I don't know if I gave you the answer, but this is how I think it's working.
Exactly. And Cleopatra, I have one final question. And because at the beginning of the presentation, you talked about how you change the protocols for achieving better quality of the cell, reducing the G-force, the changes of the speed and timing. So recently, I mean, not recently, but two different type of centrifuges, one with the fixed angles, one with the horizontal centrifuges. And do you see any differences in the quality of the platelets or the numbers of the cells that we can achieve in different kind of centrifuges? And speaking of that, what is your recommendation for those that they want to go in the market and start these procedures and buy something? I want to know your answer on that.
Because as I told you, I have started with the PRP back in 2003. I used a lot of protocols and I have used a lot of machines, centrifuging machines. And to be honest, I have 6 of them. And if you really do the protocol and if you really keep the same parameters, what you're going to, it's grosso modo the same thing. But the most important, it has to do with the count of the cells and the quality of the cells, as I did in the beginning. So according to my clinical experience and to my research, I have seen, and I highly suggest, PRF protocol by Joseph Choucroun. Now, we always in life, we should do something better and better and better. I believe that the new centrifuges, that they have changed the inclination and everything, they're trying to do something different. And of course, it's something new, and I'm very skeptical about this. For me, I teach and I believe things that I've done and I have seen. So the PRF I am talking about has all the research and the clinical experience and my cases that I can prove. Now, if I have a machine and if I do many cases, if I be able to compare, maybe after 5 years, you will hear something different from me. But right now, I cannot say anything because I think it's too quick. I think the revolution in the whole PRF was the low speed protocol and the fibrin, because as I explained to you, these were the main things that make the, and I highly recommend to people to follow this protocol.
With that said, again, I want to truly thank you, Cleopatra, for accepting the invitation. And as you said, you're on a vacation, and it means a lot that you dedicated your time to it. And me personally enjoyed your presentation so much. Thank you again, and really looking forward to see you soon, whether in my country or your country or anywhere else in the world, as soon as this COVID situation ends.
Thank you very, very much. For me, I told you from the beginning, you're doing something great. It's very difficult to gather all these colleagues together, to let them, to give them the opportunity to share their experience and knowledge. And when I was young, I was thinking that I knew everything at once. But as I get older, I see that I grow and the knowledge grows with me. So my home take message is that keep your mind occupied and think positive, and try to learn things not to make money. Try to learn things to make things different and better, and give the best services to your patients. I give you lots of love. I wish you to go to the top, and you are in the top. And it was a great honor and pleasure to share everything with you. Bye-bye. Love you all.
Love you. Thank you.
Greetings from Greece.
Thank you so much. Take care.
Bye-bye. Bye-bye. Bye. Bye.